Congressman Warren Davidson and Dr. Marty Makary of Johns Hopkins University. First to you, Doctor. Let me just get through these studies. South Africa study, just 10% of the hospitalizations are from the Omicron variant versus a Delta variant. But the UK study, the Imperial College of London, says Omicron has the same severity as a Delta variant. And there's another one that from Hong Kong and Columbia University, Omicron is resistant to vaccines. Can you break down what's happening?
Sure, Liz. We're not getting the full story. There's a lot you're not hearing about, and what you're seeing is a cherry picking of information and studies out there that is creating this ugly picture about Omicron. But let me tell you, antibody titers are just part of the immune system, and it's not even the strongest part. It's the T cells. Those appear to be working, active. They're solid from previous vaccinations and from immunity, and they're preventing severe disease. Omicron also has strong laboratory data now from the University of Hong Kong that it's not infecting the lung cells. It's infecting the upper respiratory cells. The lower respiratory cells in the lungs where severe disease forms is a very low infectivity rate. That's why we're seeing upper respiratory symptoms, not the cough and fever. We're seeing mild common cold-like symptoms. And so we have laboratory evidence, epidemiology evidence, and now bedside evidence all saying that it's mild.
That's interesting stuff. But, you know, Congressman, President Biden warning of a winter of death because of the unvaccinated. So is he trying to stake his victory by attacking instead of persuading the unvaccinated as the rest of his agenda is failing?
Yeah, I think he's looking for someone to blame and, you know, a continuing of the trend to divide America. There's got to be one group versus another. It seems to be the whole mantra, you know, divide the country, pit one group against the other. And then the solution's always the same for Democrats, is more government. So if things aren't as bad as the doctor was explaining, that doesn't really fit with Joe Biden's prescription. Joe Biden wants to prescribe more government and less freedom all across America. And fundamentally, our country needs more freedom and less government. And that's the exact opposite of the Biden agenda.
Well, you do have Radio City canceling the rest of the Rockettes Christmas Spectacular, NFL canceling games. We've got reports coming in from, you know, saying that hospitalizations are going up. When it's unclear if it's because of the Delta variant, not Omicron. So that's the issue. And the fear is, Doctor, is that the Democrats are going to take this football and run with it and politicize it. Let's watch Mayor de Blasio. Mayor de Blasio is staking his future in politics on the pandemic. Watch.
Right now, COVID's dominating our lives. I want to put COVID in the background. The flu, you didn't wake up 2 years ago and say, oh my God, I'm so worried about the flu, right? Plenty of people who don't want the government to tell them what to do, but the mandates made a difference because people are not going to lose a paycheck over it. If we apply mandates forcefully, it actually moves a lot of people.
The mandates are working because people are not going to lose a paycheck over it? What do you say, Doctor?
We were making so much progress, Liz, in encouraging adults to get vaccinated until the mandates. It froze people in their positions. Many of these folks now are never going to get vaccinated. They may never get a booster if they're older and need a booster. So they backfired. And by the way, a lot of places did not enforce the mandate, including the U.S. government. TSA workers had their deadline come and it passed. The government did nothing. Same with air traffic controllers. Large government contractors said, look, we're not going to lose all these workers. Many hospitals have come out this week and said, we're not going to enforce this. We need our staff.
Yeah, Tenet, Cleveland Clinic, Advent. Also, Amtrak is saying no, Congressman, to the doctor's point about the vax mandate. By the way, New York is at the bottom of the list of jobs are covered, and the economy is doing badly in New York City. Mandates wiped out families and people's livelihoods. There's that, too. And also we have this. The Biden White House is asking the Supreme Court to continue to greenlight the Biden vaccine mandate for healthcare workers in hospitals that take Medicare and Medicaid funding. What do you say?
Look, he's got 5 mandates. We need to stop all of them. And look, Mayor de Blasio pitches an idea that everyone responds to force with submission. You know, as Dr. Makary just pointed out, you know, not everyone responds by submitting. They've really dug in and said, you're not going to impose your will on me. And that's really presented big quandaries for the economy. Inflation's creating headwinds. Workforce participation still below 62% for 18 to 65-year-olds. And if we're going to recover our economy, somebody's going to have to make stuff. That's, you know, we've got a limited amount of supply. We've overstimulated demand. Central bankers can't do all the work. Congress is in the process of making things worse if Speaker Pelosi gets her way and Joe Biden.
Yeah.
Thankfully, you've got Joe Manchin and Kristen Sinema joining Republicans in opposition to Build Back Better. So that's good news for the new year. Hopefully that trend continues.
Doctor, to the Congressman's point, there's also trends with vaccines. Moderna, J&J vaccine, the Pfizer vaccine. It's why people are pushing back against mandates. The studies that Moderna's vaccine is up to 4 times more likely to cause inflammation of the heart muscle. Pfizer-BioNTech is showing that too. J&J, there's risk of clotting. Can you break this down? People are afraid of this.
Sure. This was the problem with the sort of indiscriminate, vaccinate everybody, all vaccines are equal approach that we had. We know in many countries in Europe, they are told they cannot and should not get the Moderna vaccine if they're under age 30 because myocarditis is much higher and that's common in young people. J&J has a risk of blood clots of 1 in 100,000 women between the ages of 30 and 50. Women in that group shouldn't get J&J. And we're learning the second dose has complications in young people, and boosters are really should be reserved for older folks with risk factors, not young people like the colleges and universities are about to mandate. There will be unintended harm from a 3rd vaccine dose in young, healthy people. By the way, the data shows 0 deaths in young, healthy people who are vaccinated without a booster.
Interesting. Congressman Warren Davidson and Dr. Marty Makary, thanks for joining us. Good stuff.